Dry cow therapy is an important part of the annual cycle of a dairy farm. It involves the treatment of cows at the end of lactation with either an antibiotic or a non-antibiotic internal teat sealant, or both in combination. These products are administered into each teat immediately after the last milking of the season. The purpose of dry cow therapy is to improve udder health and milk quality over the dry period and in the following lactation by curing existing udder infections and preventing new ones from forming over the dry period. Dry cow therapy should be carefully planned because it can have a large impact on udder health. However, it's not just the type of dry cow therapy you use that is important, but also the way it is used, which is the focus of this video. Even small changes to the way dry cow therapy is administered can have large impacts on not only the effectiveness of the product, but the risk of severe mastitis developing. The purpose of this video is to help farmers get the full benefit out of their dry cow therapy and prevent severe mastitis. You can watch the entire video or jump to sections you want to learn more about. We will be focusing on dry cow therapy. If you would like to learn about heifer teat sealing, please visit Dairy Wellness. These principles apply to any product being administered into a cow's teat. If you want to learn more about treating cows with mastitis during lactation, visit Dairy Wellness. Targeted dry cow therapy means only the cows likely to have an intramammary infection at drying off are treated with an antibiotic dry cow therapy. The remaining cows are typically given a non-antibiotic internal teat sealant like teat seal. To apply targeted dry cow therapy, you need to work out which cows should be given an antibiotic dry cow therapy. The best way to do this is to look at your mastitis data at a milk quality review with your vet. Your vet will look at your herd's mastitis pattern overall and decide if targeted antibiotic dry cow therapy would be appropriate. Then they work out what each individual cow should get based on the herd's profile and the cow's mastitis history. Essentially, vets ask two questions of each cow. 1. Does this cow require an antibiotic dry cow therapy? And 2. Would this cow benefit from an internal teat sealant? The standard way to answer question 1 is to identify cows that exceeded a somatic cell count threshold at any of at least 3 herd tests for the season. However, while we recommend farmers herd test routinely for other reasons, new research found that a single herd test done within 80 days of drying off, or a rapid mastitis test done around the time of drying off, were as accurate as 3 or more herd tests. So you can still apply a targeted antibiotic dry cow therapy even if you don't have 3 or more herd tests, provided your herd's mastitis profile at drying off is suitable. Question 2 is answered by thinking about your mastitis pattern, particularly around calving. Dry cow therapy may be the biggest animal health spend of the year on your farm. It is essential that dry cow therapy is well planned and not rushed because the quality of the job you do will play out next season. Whether you're administering the dry cow therapy yourself or you have contracted your vet clinic to do it for you, preparation is essential. The key points to confirm before you start drying cows off are who is doing it, when are we doing it, and what do we need. You will need to work out how many people you need, which is a function of the number of cows you will dry off in one go. If you need a large team, make sure it is clear who the team leader is because they will need to coordinate drying off and ensure it is being done correctly. The team leader needs to be empowered to pause or postpone a job if the weather turns or the conditions are unsafe and have the confidence to provide additional training to staff as the season progresses. Now that you have identified your team, you need to make sure they are trained. It is essential that everybody in the team follows a consistent protocol to avoid confusion and mistakes. Your vet clinic is the best resource for training, as well as this video and other Zoetis resources. You should only dry off enough cows in one session so you can get the job done in less than 2 hours. The longer the job takes, the longer the animals are in the yard and the more closed off and contaminated their teats become. It also means your staff will get tired and the cows more agitated. These problems increase your risk of mastitis. To plan your drying off dates, you need to think about how many cows you can realistically dry off in one day, which is affected by the number of operators you have, how clean the cow's teats are, and how long the cows will be standing in the yard. As a rough guide, expect to dry off about 10 to 25 cows per operator per hour, but really the job should take as long as it needs to do it properly. So 200 cows with 4 operators might take 2 to 5 hours for the job to be done thoroughly. You should also allow for bad weather. Administering dry cow therapy to cows with water running down their teats is a known risk factor for severe mastitis. Many people ask whether milk production should be reduced as cows approach drying off. Zoetis has a guide on preparing cows in the lead up to drying off, available at Dairy Wellness. Dry cow therapy should be administered immediately after the last milking when the teats are clean and open. It is risky to administer dry cow therapy while other cows are being milked into the vat for supply because the cow might be inadvertently cupped after being dried off, or somebody's hands could have a trace of dry cow therapy on them. Don't forget to think about withholding periods of antibiotic dry cow therapy, especially for your late dry-off cows. Avoid drying cows off on the last day of the season if cows need to be transported, or if continuity of care may be compromised due to staff changes. If the cows are producing very small volumes of milk, say less than 7 litres per day, the withholding periods of antibiotic dry cow therapies may need to be extended. Talk to your vet. Carefully choose paddocks for cows that have just been dried off. They should be clean, with no bare dirt or lying water. Finally, make sure you have the equipment. All operators should at least have the following things: personal protective equipment, boxes of gloves, milking sleeves or arm-length gloves, aprons or waterproof overalls, make sure you have pockets or holders for syringes, teat wipes, tail paint, etc., and hats. Personal protective equipment is essential because drying off can expose people to infectious diseases like leptospirosis and gastrointestinal bugs like Campylobacter. Also, all operators should be aware of the standard dairy farm hazards and should be competent in working around the cows due to the risk of physical injury. Drying off equipment: dry cow therapy and teat seal, allow for some wastage, paper towels for drying hands, disinfectant, warm water, buckets, teat wipes, warming buckets for warming dry cow therapy if necessary, paint for marking cows, mastitis treatments if clinical mastitis cases are found, recording pads for documenting any animals with mastitis or teat problems, head torches for dimly lit sheds, teat spray, rubbish bins. To recap, preparation consists of identifying your team, getting them trained, planning the dry-off dates in advance, and organising your equipment. Now that you are prepared, it's time to apply the dry cow therapy. First, check the weather. If it is raining and water is running down the teats, postpone. If it is cold, you may choose to warm the syringes to make them easier to infuse, but this is not essential. The best way to warm the syringes is to float the dry cow therapy bucket in a larger bucket containing warm water. Do not pour warm water into the bucket of syringes because they will become wet and contaminated. If you do warm the syringes, they need only be warmed to approximately 20 degrees Celsius. The hot water in many cow sheds is almost boiling. Overheating the dry cow therapy could burn the cow's teats and possibly damage the dry cow therapy. As you set the shed up, think about light. In herringbone sheds, cows are best rowed up on the wall side so the light is shining onto their udders. It can be difficult to find the teat orifice in dim light, especially in cows with black teat hens, and this increases your risk of damaging teats. Set everything up so it is within reach but sheltered from contamination. Keep the lids on dry cow therapy buckets. Set up buckets of warm water with disinfectant for washing hands between animals and change as needed. Make sure there are rubbish bins available because you don't want syringes, caps and wipes blocking effluent systems. Make sure it is clear which cows are getting what dry cow therapy, especially if there is a large team working in the shed. Mark and record the IDs of animals treated with teat seal or antibiotic dry cow therapy and record batch and expiry numbers of products. When administering dry cow therapy, good technique and excellent hygiene are essential. Poor technique can result in teats being damaged, and hygiene breakdowns can cause potentially fatal mastitis. This applies to all types of dry cow therapy. As well as working clean, you need to work dry. Your hands, the syringe and the cow's teat end should all be dry. You should wash and dry hands between every animal. Take enough syringes to treat one animal at a time. If you carry more than enough for one animal, you run the risk of inadvertently missing or double treating a quarter without noticing. First, the animals are loaded so they are not loosely packed and mobile. When you approach the cow or heifer, let her know you are there. Mark her up as required. Check for clinical mastitis. If you find a case, always change your gloves to prevent cross-contamination. Talk to your vet about treatment. Try to keep one hand on the teat the whole time instead of taking it on and off, which will unsettle the cow. If the cow is agitated, check you aren't pulling the long hair around her teat. The same person should clean the teat and administer the dry cow therapy. We recommend a teat-by-teat approach because it minimises the time between cleaning and administering. Do the cow's front teats first. Cleaning should focus on teat ends, not the whole teat. Cleaning requires mechanical removal of dirt. Spraying meths or teat spray is not enough and will not kill microbes suspended in dirt. Clean is when the wipe comes away clean after firm pressure. Make sure your hands are clean and dry, otherwise you'll only transfer dirt from your hands to the teat. Make sure the teat wipe doesn't brush against contaminated surfaces, such as the side of the teat or your wrist. The teat end should be dry when you come to administer the dry cow therapy. Use as many wipes as it takes to clean the teat, not a set number like 1 per teat or 1 per animal. If teats are heavily contaminated, you can send somebody ahead to remove heavy contamination first. However, cows should be treated straight after milking, so their teats should be clean. You may need to reassess the process if their teats are heavily contaminated. Perhaps the cows have been yarded for too long. Now that the teat is clean, do not spray anything onto the teat until after you have finished treating all teats. If you do, there will be a drop hanging off the teat containing contaminants that have run down from higher up the teat and udder. Take a syringe and remove the cap by gently bending the tip until the cap releases. Don't use your mouth because you might contaminate the syringe or damage the syringe tip with your teeth. Drop the cap into a bin. Strip some milk out if you cannot see the teat orifice. Hold the syringe like this and use the hand that is holding the teat to anchor the syringe so you have better control. Make sure the teat is straight and not kinked. Partially insert the syringe tip up to 3 mm, taking care not to brush stray hairs or unclean parts of the teat. If the syringe tip touches anything else, discard it and take a new syringe. Do not clean the syringe tip and reuse it. The syringe only needs to be inserted far enough to ensure the product goes up the teat canal, a maximum of 3 mm. Make sure you infuse the entire syringe contents. If the dry cow therapy runs out down the syringe instead of going up into the teat, then the syringe tip isn't properly positioned in the teat canal. Withdraw the syringe and ask somebody else to hold it while you re-clean the teat end. Gently squeezing out some milk will help open the teat and show you where the orifice is. If you're finding it difficult to insert the syringe tip into a lot of cows, they have probably waited too long in the yard. You want to retain teat seal in the teat. Gently pinch the base of the teat when you dispense the internal teat sealant and do not massage it up into the udder. If you're giving both an antibiotic and an internal teat sealant, always administer the antibiotic first and massage it up into the udder and then re-clean the teat before administering the internal teat sealant. Any clinical mastitis cases or other unusual findings on our recording sheet. After you've treated all 4 teats, apply teat spray at its high strength concentration, ensuring proper coverage. Each operator should mark animals with a unique colour to help troubleshoot any mastitis cases that occur. If you get heavily contaminated, stop and clean yourself. Before you move on to the next animal, wash and dry your hands and take another set of syringes. Wiping your hands down with teat wipes is not enough, as this only spreads the contamination evenly across your hands. Always dry your hands after washing them. We have taken advice from vets and farmers around the world and seen for ourselves what works. We've also found out what doesn't work. One of the best ways to prevent things going wrong is to have a clear plan and a consistent team approach. When people have had mastitis problems soon after drying off, we often find that there has been an untrained operator who has jumped in to help speed things up, or the whole job has been rushed and done at the last minute. Don't forget to check the wipers coming away clean before infusing the dry cow therapy. Be aware of moisture. Drying cows off during heavy rain is risky. Light rain is okay, as long as the teats are dry. Don't let anybody get carried away with washdown hoses so that water is running down the teats. Always dry your hands after washing them. Some farmers divide the work up and have one person going ahead cleaning the teats and somebody else administering the dry cow therapy. The problem with that is there is a longer delay between cleaning and administration, so it is not advisable. Teat wipes come free with dry cow therapy. Don't scrimp by using only 1 wipe per cow or recycling the wipe that was used to get the worst off for fine cleaning of the teat end. If your hands are dirty and they are making the teat wipe dirty, clean your hands and come back. Remember to keep the lid on your dry cow therapy buckets. If the syringes are getting splashed, you have compromised your hygiene. There shouldn't be any moisture inside. If there is, your hands are too wet. If you see cows sprinting back to the paddock after being dried off, you have possibly held cows off feed for too long. Don't move between cows without washing and drying your hands to avoid spreading contamination between cows. If you contaminate or drop a tube, don't try to clean it, discard it. These common mistakes all relate back to inadequate preparation, unsatisfactory cleaning, or excessive moisture. Most of the work has been done now, but there are some simple things you should do to get the most out of your dry cow therapy. Make sure cows walk quietly out of the shed to the paddock. This relates back to the number of cows you dry off in one go. Avoid prolonged yarding or lying on the ground or transport in the early dry period. When the quarters fill up with milk, having the cows boxed up may encourage leakage, which will be more problematic if the cows spend a lot of time lying on contaminated surfaces. Observe cows daily for the first 14 days of the dry period, looking for signs of clinical mastitis. Do not bring cows back through the shed to check them because that will encourage them to let their milk down. Consult your veterinarian if clinical mastitis occurs. Teat seal reduces the incidence of clinical mastitis over the dry period and at calving, but it does not necessarily prevent it altogether. Mastitis will still occur if the challenge is high, so you should still take steps to minimise environmental mastitis challenge. It is generally recommended to milk heifers and cows prior to calving if they are dripping milk. Dripping of milk can still happen even when internal teat sealants are used, although it will happen to a lesser extent. As soon as animals drip milk, the teats are open to the environment and at risk of mastitis. Heifers that develop udder edema are particularly prone to mastitis because the teats swell up and no longer close properly. Avoid excessive walking and lying for cows that are tightly bagged up before calving, as it may dislodge the teat seal plug. Animals with internal teat sealants on board are treated a little different at the first milking. Be sure to manually strip each quarter at least 10 times to remove the plug. You will usually see a long coil of teat seal come out. If after 5 strips it stops, keep going because there is usually more. It is normal for some quarters to have less teat seal present due to calf suckling. Research has shown that teat seal does not prevent calves from suckling and getting colostrum from their mothers. All dry cow therapies, including teat seal, have an 8 milking withholding period after calving. Do not shortcut this withholding period. All cows, regardless of dry cow therapy, should be withheld from supply for the first 8 milkings. Finally, make sure you can tell the difference between flecks of internal teat sealant and clinical mastitis. Internal teat sealant is typically waxy, brilliant white colour and does not dissolve when rolled between your fingers, unlike mastitis clots. For more information, visit our Dairy Wellness website or talk to your vet.